Welcome to Nurses Uncorked, where I pour out the unfiltered truth about healthcare life. I'm your host, Nurse Erica, serving up real talk straight from the front lines to your ears. Each episode, I'm uncorking conversations that matter to nurses everywhere, from the hilarious to the heartbreaking, the inspiring to the infuriating. No filters, just authentic nursing experience shared with a splash of humor and a dose of honesty. So grab your favorite beverage, put your feet up, I know they're tired, and join me as we uncork another episode of Healthcare Reality. Now let's get this shift started. Welcome back to Nurses Uncorked, where we open up the conversation about nursing, healthcare, and everything in between. I'm your host, Nurse Erica. And today we have a really exciting guest joining us. You may know her from TikTok as Nurse Rachel, MD. She started her career as a registered nurse and then made the bold decision to go back to school and become a medical doctor. She's now graduated and deep into her residency and creating content that breaks down the similarities and differences between nursing and medicine in a very real and relatable way. Today, we're going to talk about her journey from nurse to physician and what she's learned along the way and how her perspective as both a nurse and a doctor is shaping the way that she practices medicine. So grab your glass, settle in, because this is going to be a great episode. Welcome, Rachel.
Thank you. Thank you so much. I am a fan of your TikTok, and so it's an honor to be asked to be on your podcast.
Oh, thank you. Thank you. Well, I'm a fan of yours, and I've been bugging you to come on ever since I saw one of your videos. I think the first one I saw, you were talking about how it's still a habit for you to sign your name RN despite being a doctor at this point. I think that's so funny. That's so cute.
It is. Sometimes I add it at the end. I'll put MDRN, but sometimes I feel like that's a little bit obnoxious, but it's ingrained in me at this point.
It's cute. I love it. I love it. All right. Well, can you tell us a little bit about what inspired you to be a nurse, a little bit about your background as a nurse, your professional journey? I know you have published several things and you do some speaking and educational stuff. Can you tell us all about that?
Yeah. So I started off wanting to major in music. I was a flute player. And so in high school, I did a lot of music, planned on majoring in music in college. And then at the very last minute, decided to do nursing because it seemed like a more stable profession. And I just really fell in love with it in college and felt like I just couldn't get enough of it. I tutored a lot of pharmacology. And I remember at that point feeling a little bit sad that I wouldn't be able to prescribe drugs, but I would get to give them. And that seemed like a lot of fun.
Yeah.
My first job was in the pediatric ICU. And I realized I love working with children. I love the inpatient setting. And I loved working with residents. I was very obsessed with what they were doing and just learning from them. And ultimately, it was the residents that inspired me to go back to medical school.
Did they actually tell you you should go back?
So there were probably two residents that I can think of that were kind of like the canon event residents. After I had gotten into nurse practitioner school, I remember one of them telling me that I should drop out and do medical school because he thought I would be so much happier. And at the time, I think I was really in denial about how much I wanted to go to medical school. And so I was trying to convince him, like I was trying to convince myself, that I was really happy with my decision and that nurse practitioner school was going to be perfect for me. And he pointed out that I just didn't seem as happy as I should. I had just gotten into a great FNP program and he thought I should seem happier. And at the time, it seemed rude, but I think it was a good wake up call to just realize that um, there's more than the NP route for nurses. I think it's a great option, but there's definitely other options too, and medical school is certainly one of them.
Yeah, far less common though. I think especially since COVID, nurses have flocked to nurse practitioner school, CRNA, all of
Yeah.
that. But you rarely hear about one going back to school to become a doctor. I've worked with two over the years, and they were
That's
amazing,
awesome.
amazing, both of them, because I think because of their background. But I'm curious, what were some of your coworkers, the other nurses' reactions when they found out you're going to medical school?
So I thought that they would be happy for me, and some of them were, but there were a few that stood out. Some of my mentors that were actually a little bit critical about it. And I remember one of my mentors saying that I had turned my back on the nursing profession. And if I had any loyalty to nursing, I would do NP school because we need intelligent people to stay in nursing and build up the profession. And she thought I was going, quote, to the dark side by going to medical school, which I thought was a little bit sad. I was disappointed, but she has since come around since I've graduated. And I've appreciated that she's changed her stance on that a little bit.
Yeah, that sounds like a little bit of jealousy or insecurity to me. Why not encourage you to do something that ambitious, you know? What was it like working your last nursing shift? Did you know it was going to be your last nursing shift?
So that was really, I think that the time leading up to my last shift just felt really surreal because I had worked so hard to get to medical school. And I really credit nursing for bringing me there because I was going to major in music. I never would have had the dream of becoming a doctor if it hadn't been for nursing first. And so I owe the whole dream to nursing. And it just felt really special taking care of patients in the nursing role for the last time. And then my first job as a doctor is at the same hospital where I worked my last shift as a nurse. And so that felt really magical too, just to be walking in the same halls, but to have a completely different role. And I still sometimes bump into my old coworkers, and that's always really special because many of them have left the bedside also to do other things, but it's still really fun to run into them in the hallway.
I remember working my last shift as a staff nurse, knowing that I would be starting my first job as a nurse manager. And I was so emotional about that and so conflicted. I mean, it's not the same, but yeah, a part of me felt like I was going to the dark side. And it was very much like, is this the last time I'm gonna suction a trach or whatever? Is this the
Yeah.
last time I'm gonna do? Yeah, I was very emotional. So I get it. Yeah. What would you say is the hardest part about making that transition from RN back to student and med student?
That is such a good question. I think for me, the hardest part really was the humility of starting over and just being willing to admit that I didn't know what I wanted. And it felt like I had worked so hard for my plan, and I was at year 5 of the 5-year plan and just now deciding to abandon ship and do something different. And it's hard when you feel like you're good at nursing and you have a lot to offer in the field, and then you pivot to a different role where now all of a sudden I'm new and I'm not good at something. And especially going from nursing to medical school, you have to get all of the prerequisites for medical school. And so I enrolled in chemistry and physics at my local university, which meant taking those courses alongside 18-year-olds
Oh,
after I
yeah.
had been a nurse for several years. And so that was a little bit humbling and sometimes lonely,
Yeah,
but in the end it was definitely worth it. It was just a difficult year to do the post back.
I can imagine. Were there any moments during med school where your nursing experience gave you a clear advantage?
So to be honest, I thought that it would give me an advantage more than it did. I thought that I knew
Yeah.
so much as a nurse and thought, well, I already know a lot about these diseases and I have a good understanding of quite a few things. And I found myself very humbled in medical school.
Yeah.
I would say the biggest part where I did have an advantage was anytime it came to interpreting patient scenarios with labs and vital signs, I would be able to just glance at it and know whether the patient was sick or not, and to kind of get an idea of what they would look like in the clinical setting, which I think was something that took time to come to those who hadn't been at the bedside before.
Yeah.
But the harder parts of medical school is just the amount of memorization that there is. And I found that that was still just as challenging and very humbling. It made me feel very small to be in medical school. But I think that's part of what made it exciting is to feel small and to feel like there's so much that there is to learn.
Yeah, I that would be challenging. You hear about the novice to expert. So you were kind of probably teetering on that expert point in your nursing career and then to go back to novice and in the student mindset, that's
Yeah.
that's a lot. Kudos to
And
you for
to go
being
from
brave enough.
making I was a travel nurse, so to go from making travel nurse money to paying to be in the hospital, I called it my riches to rags story.
How did your background in nursing shape the way that you approached med school compared to your classmates? Do you think you went about it differently?
I think that it definitely gave me a lot of compassion and empathy for patients early on when I would see patients receive a diagnosis that was really difficult, or just being able to understand why patients reacted the way that they did. And even if it seems like patients aren't handling things well, just knowing from the nursing perspective that there's so much behind the scenes that happens that we miss on the provider side because we're not at the bedside as much. And so we don't see the family interactions quite as much as nurses do.
Yeah.
Um, so that was really helpful. And I think just also being really in tune to what the nurses are saying about the social interactions. If nurses are saying that family members have placed stress on the patient, or whatever nursing insight might provide, I just took that very seriously because I knew that the nurses knew best of all what the patient was going through on the day to day.
Yeah. Okay, here's the number one question that I want to ask you that I've been most excited to ask you about above all else. From your perspective, what was harder, nursing school, med school, and what are the biggest differences between the nursing education and the medical education?
That's such a hard question. I would say, to me, I find nursing much more exhausting than medical school and working as a resident, because it's so overstimulating, it's so busy, you're responsible for so many things at the bedside, and you have so many distractions coming at you, and you can't run away and be at a computer with a closed door. And I find that that helps so
Yeah.
much in medicine when you can go work on notes, even if it's just for 5 minutes at a time, in a place that's a little bit removed from the beeping and from the patients hitting their call bell, and just being the first to respond to every need as it arises.
Yeah.
But I would say academically, I think that medical school was more difficult than nursing school.
Yeah. I had a weird moment a million years ago when I was in nursing school. My ex-husband's niece came to visit, and she was in medical school, and I had all my nursing books out, and she looked at them, and she was shocked and said, "These are the exact same books that we're using." And I would have never guessed that in a million years. Did you notice any similar books in some of the classes?
That's so funny. So I actually didn't I never read a single book in nursing school, and I
Oh,
never read a single book in medical school.
really?
So I'm probably
Oh my god.
I'm probably not the one to ask, but I do have some of my nursing school books because one of them, my professor wrote a chapter, and so I had it autographed by him, and I saved it as like a souvenir, but I never read it.
Okay.
And then in medical school, to be honest, it's a lot of third party sources. And so, we have like one source called Sketchy, and it's a lot of little like cartoons that they draw and just ways to cram and memorize all of this information. And so I found myself watching a lot of videos online and paying a lot of money for these subscriptions to learn, and not so much reading books. But maybe if I had been smarter, I would have read more books.
I mean, you clearly have managed nonetheless. What was the biggest learning curve for you in residency that nursing maybe didn't prepare you for so far in residency?
For that, I would say personally, what's been hardest for me is being in the position of I would say making the initial decision, because there's always the senior, I'm the intern. And so there's always the senior, there's always somebody else that's helping with making decisions. But just realizing that there are some decisions I can make as an intern, and feeling like that's an okay call. Like, even the first of everything just feels like I shouldn't be the one doing this. Like the first time I said an NG tube was in the right place felt weird. Like, don't I have to ask somebody else? Don't we need to have a doctor to
Oh,
say that
yeah,
the
that's
NG tube
interesting.
looks, it looks right? Or delivering a diagnosis. I think nursing taught me so much that we can't diagnose, we can only describe symptoms. And so to
Yeah,
tell patients what they have and what their diagnosis is sometimes feels weird. Like, I should check this with somebody before I say it.
like you're crossing some sort of invisible line.
Yeah,
Yeah.
like I'm outside my scope of practice.
Yeah, that's interesting because it's ingrained in us. Yeah, that makes
Yeah, it
perfect
really is.
sense.
Yeah, and when I'm looking at X-rays, when as a nurse, I would say, "Well, I'm not the doctor, so I can't provide an interpretation." And now
Right.
it's like, "Oh, actually, I can tell you what I see or what I think I see."
What do you wish more doctors understood about nurses?
I think just how how difficult it is and how much nurses know. I think that that's something that is it's hard to pick up on because never having gone to nursing school, I don't think they realize how much training nurses do have in certain areas. And there are so many things that nurses learn that physicians maybe don't learn in medical school. Just recognizing the expertise and when nurses come to residents with concerns, it's usually rooted in something very reasonable and something very rational because they do learn a lot about assessment in nursing school. And even though we're not diagnosing, we do know a lot about disease processes and what symptoms could mean something bad.
Absolutely. Okay, what about the opposite of that? What do you wish more nurses understood about doctors?
So with this one, I think that hits closer to home now that I am on the doctor side. And for me, I wish that nurses well, I think some nurses do really know. Most people are wonderful and very, very kind and helpful. But when nurses are hard on residents or think that we don't know anything, that really hits close to home because we're already insecure and feel like we don't know anything as interns, and we rotate through all these
Yes.
different units. And if they think that we look like we don't know what's going on, we probably feel that way times 100 already. And so
Yeah.
I think just being educators and being supportive and being excited to help us learn and to recognize that we're still learners and we're new on the unit. And even for me in pediatrics, I worked as a pediatric nurse, but being on different
Me
units,
too. That's my whole background.
amazing. It's the best. I love
I know.
pediatrics.
Me too.
But even the NICU, that was one of my first rotations in residency, and I realized I don't know very much about the NICU because I worked in the PICU, and so there was so much that was new to me, and I'm sure so many things I said that seemed really silly or like I had no idea, not a clue, and I was really grateful to the nurses that helped me kind of learn the ropes and taught me about the NICU without making me feel like I didn't know what was going on.
Did you never have to float to NICU as a PICU nurse?
I
Because I did
didn't. I never
all
did.
the
I
time,
I
all
ended
the
up
time.
going to the floors to step down, but I somehow made it out without ever going to the NICU.
Lucky you. Yeah, I'm not a fan. It's a weird relationship, I think, always between peds and NICU nurses. It's like,
Yeah.
"You're our family, and we're gonna defend you because we get it, but, like, also, we do not wanna be you, and
Yeah,
you are a different breed."
they are. They're a very different breed. I like to put it as they take care of the unboxed babies because they're still in the isolates and it's hard to do a
Yeah,
product review when you can't unbox it first.
that's true. I like that. All right, let's talk about the disparity in income. You kind of touched on that. So now that you're out of school and working, how does the income compare from what you were earning as a nurse and now in residency?
So I always take the most dramatic approach and compare it to my travel nurse salary because that was
Of
the most
course.
recent salary that I had. And comparing that, then my travel nurse salary for a week was about what I make in a month as a resident. And that
Oh my
includes so
gosh.
I'm in a unionized residency program, and so we actually
Yes.
we get
I
paid
love
pretty
that.
well compared to other residents, and we get extra money. It's about 10,000 extra a year that the hospital gives us on
Shout
top
out
of our
unions.
salary. Yeah, I think it's really important for residents to unionize. So I'm supportive of that and glad to be at a unionized program. I think coming from medical school where I was paying to be at the hospital, I you could give me any amount of money and I would feel so rich even if I made less than minimum wage just because it's nice to be paid again.
Yeah. Yeah. That's gotta be such a hard transition to go not just back to student mindset and back to school and switching focus, but to also go from decent income to no income. That's gotta be rough.
Yeah, it was. I'm honestly nursing helped me save though because the travel nursing for the last year I was able to pay for the first year of medical school and my living expenses. And so I took loans out for second, third, and fourth year, but for the first year I didn't have any loans, which was helpful.
That's good. Yeah. What kind of responses have you gotten from nurses versus doctors since you started sharing your journey on social media? Have you faced any criticism online from either?
So I think that part of why my following grew is not because I'm charismatic or naturally popular, but because people argue a lot in the comments. And there's always going to be doctors who say nurses don't, like, they shouldn't go to medical school or it's not an appropriate pre med degree. And then there are nurses who say, well, nurses know more than doctors. And then it just goes back and forth. And so I think that just the engagement alone has definitely helped. But at the hospital, it's interesting because I don't really talk much about my TikTok amongst coworkers just because
Right.
I don't wanna be obnoxious about it, but every now
Yeah.
and then somebody will recognize me, and that's always interesting when people are like, "Oh, we didn't know you were a nurse." And then I feel like people get even nicer to me, and,
Really?
they're nice to begin with, but then they get even nicer, and part of me wishes that we could all just start off being really nice to residents even if they hadn't been a nurse before medical school.
Yeah, I agree. But why do they think that nursing is not an appropriate degree,
I don't know,
an
I think
undergrad degree to go into a medical school?
there's so many people on my TikTok that say that nursing is like a watered down science degree or it doesn't really apply to medical
Oh, that makes
school.
me
I
sad. I didn't know
know.
that.
I know, it's
Wow.
really sad. I think it's a great pre-med degree. I would love to see nurses go to medical school. It's applicable, it's so clinical, and I think so much
Yeah.
of nursing applies. It's very useful in medical school, it's useful after. So I think it's a great pre-med degree, but there's definitely people who would beg to differ.
What do you most get for an undergrad degree? Like biology or what
It used to be
typically?
biology, biochem, chemistry, physics, something in the sciences, which nursing is a BS, so it is in the science,
It is.
and now I think a lot of medical schools are pushing for non-traditional students, and so, I mean, any degree can be a pre-med degree if you want it to be. You could go for history or psychology, animal science, really anything, and so I think nursing fits in perfectly with that.
Yeah, it makes you more diverse, right? But I
Definitely.
I don't think that's the only reason that your social media has grown. You're not giving yourself enough credit because it's really entertaining. And then you also do a lot of content around dating as a
Oh,
medical
yeah.
professional, which I think is so funny. Are you comfortable sharing the story about the beta
Yeah.
fish? I
Oh, the
loved that
beta
one.
fish, yeah, so that was I this was back in pharmacology. I love tutoring pharmacology. The beta blockers are my favorite class of drugs because I would remember them as the ones that are, cardioselective and so safer to give in asthma are beaming hope for those with asthma, so B, E, A, and M, and so one of them is esmolol, and so that was one of my favorite
Okay.
drugs, and so when I adopted a beta fish, I thought, "Well, I have to name it esmolol, and I'm gonna tell everyone that he has asthma." And so I had this asthmatic fish named Esmalol, and I told this story on a first date, and the guy didn't even laugh at all, and I was just like,
Oh no.
why can't you appreciate this? Like, this is comedic gold, and you're not even chuckling." And so then I kind of launched into this dating mostly in the medical field, and I don't know that medical people are the best to date. I kind of think maybe we tend to be a bit toxic. So, I don't
Yeah.
know.
Yeah. I mean, I think that especially the ones that go straight into medical school, right after, it's almost like socially, I'm probably gonna get so much hate for this. They are a little bit stunted because they're almost like stuck just as far as interpersonal relationships, not intelligence or anything like that. They're almost still stuck in high school because they're so busy. They don't have time to really interact and do a lot of things and have carry on relationships. I don't know. Am I way off?
I don't know because I didn't go that path, and so it's tricky because I feel like that wasn't my
Yeah.
experience, but I don't know, it's very interesting. I think dating in the medical field is maybe not it hasn't worked out for me so far, so I think I need to branch
No.
out.
Yeah. I think there's pros and cons each way. Like you can sympathize and understand when you say I've had a bad day. It's not like someone that works in an office saying they had a bad day. You can
Yeah,
sympathize, but yeah, there's definitely challenges for sure. Yeah.
yeah. My most recent date, I the waitress actually it was a first date, and the waitress recognized me from TikTok, and she said, "Oh, you post dating TikToks?" And I was like, "No, not like a lot, like, a very small following, like, very infrequently do I talk about dating stuff." And the person that I was on a date with, I could tell he was just like, "Who is like, this is gonna be bad for me. Like, what's going on? Who are you?" Because he had no idea about my TikTok. And so,
Yeah.
I don't know, it was kind of funny.
It's like, am I gonna be your next Taylor Swift song, your next video? Yeah.
Yeah, exactly. Fortunately for him, I don't have that much of a following that that would be a problem, and I would never mention people's names, but it
Yeah.
made it a little bit funny and a touch awkward.
Yeah. I can imagine. Do you see yourself continuing content creation throughout your career as a doctor?
I would love
Think you
to.
will?
I think it's a really fun space, and I talk a lot, and so it's fun to just have people to chat with online, and it's really encouraged me I mean, now I've done it for a few years, and I took a break in medical school because I think it's just not worth it with
Yeah.
the time, but then also just worrying about how things will be perceived and applying for residency. I think it's important to just probably easiest just to keep the social media just pretty silent during medical school and just kind of lay low and focus on studying. But I did start a little bit during first year of medical school. And so now at this point, there's a few nurses who have gone the MD route and have applied to medical school. And a few of them now, maybe 3 or 4, have actually started medical school or are starting this year. And so that's been really encouraging when they reach out to me and say that I was the first nurse that they had heard of doing that. And so that encourages me to keep going because I think it's important that nurses know that there's options out there.
Well, and I would be surprised if there wasn't someone listening to this that didn't feel inspired by your journey. So I agree. I think it is important because that's really not on our radar, as a nurse. We think NP, CRNA, go into education, sure. But that's like another stratosphere that we don't often think about entering. So I,
Yeah.
I do think it's inspiring. Yeah. As someone who's been both, how do you see the relationship between nurses and doctors evolving? Do you think it's gonna improve? What do you think? What are the challenges?
I think from my perspective, it will get better, especially as more nurses go to medical school because I remember as a nurse thinking that people who were nurses and people who were doctors were completely different people and almost like they were just born that way and there was just miscommunication and they just didn't really get each other. And then after going to medical school, I realized a lot of the nurses that I worked with that I viewed as just the best nurses would have also made really incredible physicians. And I think a lot of the personality traits are very similar. And even some physicians that I've worked with, I've thought they would have made really good nurses. They're so just very insightful socially. They're very kind at the bedside. They're so empathetic. They're great at listening. And a lot of times they do patient care. You can catch them changing a diaper on a baby because they are there and they might as well. And I just think, well, they would have made a really good nurse.
Yeah. I don't know that they would appreciate that though, as a compliment, would they?
There's an orthopedic surgeon that I worked with, and he was wheeling a patient down the hall I was blown away. I was like, why is this surgeon doing transport? And he
Okay,
joked,
wait, his name wasn't Dr. Thomas by any chance, was it?
no.
Because Dr. Thomas, a peds ortho surgeon, is the be all end all, will jump in and do hands-on patient care. I've walked into him changing bed linens.
Oh
It's
my goodness.
amazing. Yeah, amazing. Shout out
That's
Dr.
the
Thomas.
best. No, so maybe there's 2 on this planet then because it was a peds ortho surgeon, and he was wheeling a patient down the hall, and he joked that he's part nurse, and I was like, "You actually are. I think you really are part nurse."
I love that. So, looking back at this point, do you think that your path through nursing before becoming a doctor has made you a better physician overall?
It definitely has. I can't imagine life without it. It's made me a better doctor, but also it's made me a doctor because I never would have had the dream of going to medical school without first being a nurse, and I think the background from both I'll never stop being a nurse. I always feel like I'm still a nurse with the patients. I still introduce myself by first name because I wanna be relatable, and to me, it just the doctor feels it just feels strange to me because I've always introduced myself as Rachel to patients, and so I've continued
Yeah.
doing that, and just the way it helps with collaboration and connection in the hospital, and even with patients when I tell them that I was a nurse before, I think it makes me a little bit less intimidating and nursing is the most trusted profession. And so I think there's something about just knowing that somebody is a nurse that helps build that rapport with patients. And so even though it took me longer to go from nursing to medical school, and now at this point I've been a nurse for 8 years, I think, and so it's been a while, but so worth it, and I wouldn't change a thing.
Now for your enema of the week.
As a nurse, I've given a lot of enemas throughout my career. In the hospital, they're a tried and true way to relieve severe constipation, prep someone for procedures, pre op, and help patients feel better faster when nothing else is working. But here's the thing, you don't have to wait until you're in a hospital bed to get that kind of relief. That's why I love Happy Bum Co. They've taken what's traditionally been a clinical, often intimidating procedure and made it accessible and comfortable and empowering to do at home. Their kits are designed with safety and ease of use in mind. The no mess reusable system uses a gentle gravity design, no harsh pressure, and no complicated setup. From a nursing perspective, enemas can be an evidence based option when things like dietary fiber and over the counter laxatives just aren't enough. They can help soften stubborn stool, relieve uncomfortable bloating, and just kind of help get things moving again. And unlike some stimulant laxatives that can cause cramping, an enema works more locally, so it's usually gentler and faster. Also offers other natural products and blends, so you can choose what works best for your body. Their educational resources walk you through the process step by step with the same kind of guidance you'd hope to get from a trusted healthcare provider. So if you're struggling with constipation, want to support your gut health, or just need a reset, Happy Bum Co. makes it safe and simple. Check out happybumco.com and use code Nurses Uncorked for 15% off your first bundle. And feel better from the comfort of your own home. This week's Enema of the Week award is brought to you by Happy Bum Co. And this week I am awarding it to the New Zealand Health Minister, Simeon Brown, because recently at a New Zealand Nurses Union conference, which took place only 1 week after 36,000, yes, I said 36,000 nurses and CNAs went on a 1 week strike, he got up in front of the room full of nurses and said, "You're hurting patients by going on strike. You need to put patients first." What in the gaslighting empathy manipulation is this absolute tool doing? Like, read the room, dude. What is wrong with you? How bad does it look for you to actually not support nurses so openly? Normally, politicians at least try to hide their disdain for nurses, but not Simeon Brown. Oh, no, no. And that's why he's getting the Enema of the Week award. But there's even more to this. When he said that, nurses in the audience got up, stood up, turned their back to him speaking, and stayed standing up with their back to him for the remainder. And it made all the other nurses get up and do the same, follow suit. Amazing, amazing power move. The optics of it were like chef's kiss. On the first day of their strike, they were outside the health minister's office. And in the big windows across the top of his building, he posted signs that said, "The New Zealand Nurses Union strike disrupts more than 13,000 surgeries and appointments." Like, while they're on strike, he's actively posting things publicly not in support of nurses and frontline healthcare workers. This guy is an absolute tool. He also gave an interview talking about how cataract surgeries needed to be rescheduled and there's a real human cost. Cataract surgeries are not crucial, dude. Come on. Have some perspective. And then when he was asked how he felt about the nurse's reaction to his statements, he said, he's unfazed, just unfazed. Yeah. Mind you, all of this comes on the heels of a new report released in New Zealand that says they were short a total of 587 nurses per shift on average in 2024. That's for all of the hospitals there in New Zealand. So this week's Enema of the Week award absolutely goes to Simeon Brown, who is so deserving of the enema award. Do you still have your nursing license? Is that a thing? Can you do
I
that?
think I do. I think I do. I need to check on when it expires, but I feel like I did renew it, and I think it is still valid.
That's so funny. Yeah, I feel like I could never not renew it. Even if I went into a
Yeah.
completely different non-medical career, I feel like I would always renew it to have it just in case. But I never thought about that as an MD. I mean, why would you? But I get it.
Yeah, I feel like nurses always add all the letters after their name, and I'm like, "I can't lose the RN, those are the
We
most
are bad
important
about
ones."
that. Yeah, the
So,
alphabet soup. We do enjoy an
yeah,
alphabet soup after our name.
I love it though, I'm all here for it. People work hard for their degrees, and I think they should all be on there.
That's true. What advice would you give to a nurse who is thinking about going to medical school?
I think first just believing that you can do it. If you did nursing, then you can definitely do medical school, and just being okay with a lot of people questioning the decision, and that's okay. It's fine when people think you're making a bad choice if you know that that's what's right for you, and being okay with starting over and feeling like you don't know anything and that things might not work out, and that's always a risk that things might not work out. Maybe you do a post back and then don't make it into medical school. That's no one can prove that that won't happen, but I think with a nursing background, people are really phenomenal applicants for medical school, and it gives people a definite leg up when they have all of this clinical experience. And for the most part, the majority of nurses who apply to medical school will make it in because people really do value the experience that they bring to the table.
Yeah, and I think to ignore the naysayers, like the ones that you came across. You can do it. It's just thinking outside the box, really, for a nurse. And I
Yeah.
think that you absolutely will inspire more nurses too, because it just isn't on our radar. But once it's on our radar, I feel like more nurses will consider it, you know? Because no
Yeah,
one wants to stay at the bedside anymore. Let's be real,
I
right? So everyone's
know.
kind
Well,
of looking for an exit plan.
that's why I say nursing was too hard, so I went to medical school.
And I love that. You need that on a t-shirt or
I
something.
don't wanna offend people, though. I don't want people to think I'm calling being a doctor easy because it's not, but it's hard in a different way, and I think that's what
Yeah.
makes it refreshing.
Yeah, absolutely. Well, thank you so much, Rachel, for joining us today and sharing your story. It's not every day that we get to hear firsthand from someone who has walked in both nursing shoes and physician shoes, and your insights are going to stick with a lot of listeners. But tell everybody where they can find you.
Yeah, well, I'm on TikTok as Nurse Rachel MD and then also on Instagram. I tend to keep Instagram for some reason I care how I'm perceived on Instagram, but not on TikTok. And so I don't post dating content or anything on Instagram. That's more of my personal life. But definitely on TikTok. I'm always happy to chat with nurses who are interested in medical school. And I'm just rooting for all of them.
Well, Instagram's supposed to be very aesthetic, right? I fail at that.
Yeah.
I post the same things on everything. But yeah, it's supposed to be very aesthetic, and TikTok is supposed to be in your pajamas wherever you happen to be. And I excel at that.
Same. I love the chaos of TikTok.
Yeah. For those of you tuning in, make sure you follow Rachel on TikTok and social media at Nurse Rachel MD. Her content is very entertaining and educational and thought provoking for both nurses and doctors alike. And if you loved this episode, please consider becoming a patron. There is a link in the episode description. And don't forget to share Nurses Uncorked with your colleagues, leave us a review. And until next time, keep advocating, keep learning, and don't let the bastards grind you down. I'm Nurse Erica, and I thank you for listening.